Hello, all. This is Dr. Dheeraj Masapu. I'm a consultant anesthesiologist, and today we have Dr. Rajiv Iyer, who is a professor in University of Pennsylvania in USA, and he has started his journey in PJ Chandigarh from India, and he has ended up being a professor in Pennsylvania University in USA. So we'll ask him how actually his journey started from here to there. So, welcome to the channel, Dr. Rajiv, and can you please tell us your story?
First of all, such a pleasure to be here, and thank you for having me. So, I started my medical school in Bangalore. I did that from Bangalore Medical College, and then subsequently, I did PG in anesthesia from PGIMER Chandigarh. I was very fortunate to get into such a prestigious institute, PGIMER, where I did my MD in anesthesia. And subsequently, I did senior residency, which is quite common in these institutes. And then I was exploring my path to just go outside India, just get some experience to see how things are. So I started applying to fellowships in both Australia and Canada because I realized these two countries at that point of time did not need any exams. By the way, Canada still does not need any exams. And then I was got selected into a fellowship in adult anesthesia in one of the hospitals in University of Toronto. But my main focus was to do fellowship in pediatric anesthesia. So after that fellowship in adult anesthesia, I was able to do pediatric anesthesia fellowship in a hospital called Hospital for Sick Children, which is actually affiliated with University of Toronto. Fantastic hospital. And then while I was doing this, I realized there is a unique pathway in the USA called alternate entry path, where people can actually come and be a consultant physician or an attending physician without having to repeat residency in the USA. I thought this is fantastic. So I applied for a few hospitals. I had my interview. I even got selected to be a consultant physician at a very prestigious children's hospital in the USA. And I worked there for quite a few years, and subsequently I got an opportunity to move to University of Pennsylvania, which is regarded a very premier. In the USA, this is considered an Ivy League university. When you speak of Ivy Leagues, these are considered very prestigious universities where most US graduates want to study. So that's how I landed in my current position here.
Oh, super. Very nice. Very inspiring story, actually. A lot of effort is there, I can understand, because entering PGA itself is very tough. And after that, you have gone through a lot of struggle and hurdles, I think, in the process. But I think you have that energy to do. And I'll ask a straight question, sir. Like Canada, many of the Indian students are interested to enter. And my audience are also, many of them are post MD anesthesia students and MD anesthesia students. So, as a MD first year student and post MD student, so how should they actually prepare prepare themselves, and what kind of planning they should do and pathway to enter Canada, basically for a fellowship or a job, because either things are okay for them. So if they have to do a job, how should they plan? If they have to do a fellowship, then which fellowships are better? How should they plan? If the person with zero knowledge, how should they do?
Yeah, so this is a great question. In fact, on my YouTube channel, IMG Secrets, we have a lot of folks who are really interested in moving to Canada, and we do provide a lot of guidance to them over there. So essentially, the best option, in my opinion, is to move to Canada as a clinical fellow. Now, in order to be a clinical fellow, you must complete your PG training in your home country, which is India, or any of your home country. And then once you finish that, it's always beneficial. You have a few years of experience. Maybe I would say more like 1 to 3 years of experience post PG. So you have some level of confidence to manage anesthesia cases. But the most critical thing is when you're doing your PG, you have to establish your CV. Of course, the question is, how would you do that? Now, the easiest thing for most people is to go just attend conferences, just attend them. That itself will give you a lot of things to put on your CV. But more importantly, it's better you get involved in projects. Now, these projects can be educational projects, quality safety projects, or research projects. If you're in an institution like PGI, AIMS, NIMHANS, it's a lot easier to get involved in research projects. But I understand it's not that easy for many MD or DNB students. But try your best to get involved in those and present them at conferences, because these presentations count a lot. Even more important, if you want to progress a step further, if you publish these papers, this could be a simple case report, it could be an educational review, or it could be a real research article in a good journal. I mean, there are a lot of journals which are what is called as predatory journals. They just take the articles and they just publish it no matter what you send. Those won't be helpful, because if you send me your CV, if I read your CV with all these publications, I would clearly figure out these are not high quality. So focus on journals. Indian Journal of Anesthesia is a fantastic journal to publish. And there are many international journals that you can publish in. So these are some of the things which really give you an edge when you apply for fellowship. And also, the fellowships in Canada are very competitive. What I mean by that is there are many IMGs and other candidates who apply for very limited number of spots. So the higher quality your CV is, you're in a better position to apply and also succeed in getting a fellowship.
Got it, sir. So basically, for example, I have done some 5 presentations and I have done 2 publications. And is that considered a good CV, or it's an average CV?
Well, there are not a minimum number of prescribed publications and presentations. Of course, the more you have, the better it is. In your example, I would call this as mostly a moderate CV, not a high quality CV, but it's still better than not having anything.
Got it. I understand. So according to you, I think more maybe around 10 publications would be considered as a good CV, maybe.
I would say,
Good quality
more than the number. I mean, what is the topic it's published in? What journal it's published in? There is a difference in having a research article in the Journal of Anesthesiology as compared to having in a journal with an impact factor
low impact factor. Got it.
With less than 1 or even less.
Got
So
it.
quality and quantity both matter.
So original articles are better. That is what you're telling. Got it.
Original articles are the best. No matter whether you're applying for fellowship, a consultant job, or even if you're already a consultant in the USA, in Canada, Australia, anywhere, in an academic place, you want to get promoted to associate professor, original articles is the best.
Okay. Then I think presentations in international conference presentations also will matter, no, sir? Going from India, going abroad to other countries and presenting.
The more you have, the better it is. Certainly international matters, especially if you're able to travel to some of the well-known countries like Europe, Singapore, Australia, New Zealand,
same
Canada
country,
itself.
like Canada, if you're
USA.
targeting, and going to Canada and presenting also will help, I think.
Yeah, going to Canada would be the best case scenario, because it does 2 things. So one is, obviously, you're presenting in Canada. The second thing is, if you're in a conference in Canada, then you're more likely to meet program directors from Canada.
Got it.
And then you can talk to them and then kind of establish connections. There are some key ways of talking to them.
Okay.
You just don't go and say them, please give me a fellowship. They won't do it. And so we coach all this at our IMG Secrets, and we provide IMGs that base so they get competitive when they apply for fellowships.
Can you tell us this one way of talking, one secret you have to reveal?
Well, I would say if let's say, meet a program director and if I'm interested in getting a fellowship, I would, quickly go to the site, open the Google, read a little bit about them, see if they've done any publications. Let's say I'm
pediatric anesthetist only. If he is a head of pediatric.
I'm talking to a pediatric anesthesiologist who is published in the space of spinal anesthesia in children. Then I would go talk to them. Dr. So-and-so, it's such a pleasure meeting you. I'm Dr. Iyer, and I'm a pediatric anesthesiologist or an anesthesiologist who is working in so-and-so hospital in India. And we have quite a bit of unique neonatal infant population in which we are exploring the process of putting spinal anesthesia. You know what? Interestingly, I came across one of your articles, and it's so fantastic. It has really changed the way I practice spinal anesthesia. I mean, it could be partly true, it might not be true, but at least,
Yeah,
you're saying something that, hopefully you're meaning it, but you know what I mean.
I understood.
So then, you establish that connection, and then you start talking to them. So how do you do your spinal anesthesia? Can you share any tips, secrets? And then hopefully you can exchange their number, get their email, and then communicate with them on a spinal anesthesia level, and slowly open up saying, you know what, how about, since you're doing such a fantastic program in spinal anesthesia, I come to your hospital, observe, or maybe even better, I do a fellowship where I can get a position and learn from you, who is the best person doing all the spinal anesthesia, so I can come back home and establish a similar program or something like that. So this is kind of what I would approach as.
Super. Sir, so then I have finished my MD now from a good institute or an average institute because everyone cannot get the opportunity to do in PGI Chandigarh and AIIMS. So only maybe 0.1% will get the opportunity. So I've done from an average institute, and then I have done some presentations like this, what you told, international one. And I spoke to one of the fellowship director also. He showed some interest. So after this, how to go about?
So the way you would approach this is, so there are 17 universities in Canada. So all 17 universities has a lot of different affiliated hospitals. Now, if you take the example of, I'm trying to think, Bangalore Medical College in Bangalore, it has a lot of different hospitals affiliated with it. So similarly, all the universities will have a lot of different hospitals. Now, some university may have many anesthesia fellowships. So University of Toronto probably has close to 12 to 15 anesthesia fellowships. So once you go into each university website, you can look at the fellowships and make a list of those. So preferably pick a fellowship that most people don't want to do. This is because you don't want to compete with Canadian graduates. Then it'll make your life harder. So you want to make sure you pick a fellowship to begin with that is easy to get in. And now, how do you know which is an easy fellowship? I mean, when people talk to us, so we guide them what to focus on. So once you do that, then you see if they have a deadline in applying or not. If they have a deadline, sure, you stick to the deadline. If they don't have a deadline, you still apply to the program director seeking your interest in a particular fellowship. Now, the way you want to apply is you write a fantastic email, not too long. It's usually about 2 to 3 paragraphs, about 10 lines, explaining very briefly what your expertise is. And then you send them an email with 3 attachments. So one is your professionally made CV. Your CV must look amazing. So at IMG Secrets, we help IMGs refine their CV, and I see none of the IMGs can get the CV correctly. So the CV is really critical, and making it look professional is really important. The second thing you want is a personal statement. A personal statement is a description about yourself. Usually I stick my personal statement to 1 page, and then some programs may ask for a cover letter. It's essentially the same with some slight differences. So I keep my cover letter to 2 pages, and then your profile picture, which means you have a picture where you're professionally dressed. So these are the 3 things I would send to the program director, and then that's how you apply for those fellowships. So essentially, a cover letter or a personal statement, CV, profile picture, a nice email.
So then, with your knowledge, what is a very competitive fellowship after anesthesia, and which is a Based on like pediatrics, neuro, and cardiac must be competitive. I feel so.
Okay, so the fellowships that are really tough to get in are, you're right, neuro, cardiac, pediatric, pain medicine. I
Okay.
would say these four are really tough to get in, and probably even obstetric anesthesia. Now the question is, what are the easy ones?
Yeah.
It depends on. It's a bit tricky. It depends on what fellowship you're applying to, and there is a bit of analysis here to see the university, the program director, what are the past fellows who have done there. So you have to spend a bit of time trying to analyze what fellowship will suit me and what is more likely for me to get in. And this is true not only for anesthesia, this is true across all specialties.
Okay.
And that's what we try to help IMGs in analyzing this. So
Sure.
I would say, if I have to pick a fellowship, if a fellowship says clinical anesthesia or something like that, which is very vague,
Yeah.
then that would be relatively less competitive than others.
Okay. So better to choose something which is less competitive, enter, and then sort out how to settle there.
Exactly.
Okay.
So once you get your step into Canada,
Yeah.
then getting a second fellowship and so on and so forth becomes a lot easier. It's only the first step which is really difficult, because they're really hesitant to give an outsider a fellowship, because
Yeah, a lot of
obviously
reasons are there.
you're doing a clinical fellowship, and you don't enter with an exam,
Oh,
unlike the USA.
yeah, correct.
So they have to put a trust in you and see that you do a good job.
Got it. So now I got approval from the director and clinical fellowship. He agreed for maybe 1 year duration, and then I have to come. So so there is no exam, I understand, but there will be some process now, sir, like involved. So what will be the next step?
Yeah. So once you apply for a fellowship, and let's say the next step would be you would be called for an interview. The interview would usually be on a phone, and these days it's mostly on a video call. When I did, it was on a phone because the concept of video was not very common. But now you go through a video call, and if you get successful, congratulations, you would get an acceptance letter from the university. And after that, you're expected to complete an English proficiency test.
Yeah.
Now, there are three tests that can be done. One is called the CELPIP, the other is the IELTS, the third one is the OET. The OET, or the Occupational English Test, must be on a computer. It can get very confusing. So to keep it simple, you do IELTS. There are a lot of centers in India. You can finish that. You just have to get a band score of more than 7 at the same setting. So that is important. So once you finish this, then the hospital will work with you for you to get a license. So I'll take the example of Toronto because I'm really familiar with that. Now, Toronto is in the province of Ontario. The Ontario license providing agency is called College of Physicians and Surgeons of Ontario. Now, they have to issue a license, which in this case, as a fellow, would be a training license. So they would work with it's called CPSO, College of Physicians and Surgeons of Ontario. They work with the CPSO, and there is also an office called PGME, Postgraduate Medical Education. So in collaboration with all this, you would be able to get a training license once you land in Canada. But all the process would be going on in your home country, in India, as you're getting ready to move to Canada.
Got it. Now
That's
I
how
got
one
training
gets a
license, and then I passed the IELTS exam, and I have approval from the program director. So then, can I start flying, or is there any step in between?
Not really, not really. So the thing is, you would get what is called as a work permit, and in Canadian terms, this is called a closed work permit. It's closed because it's an employer-specific work permit. Now, if you have a spouse, you have children, your spouse is eligible to get what is called as open work permit. So open work permit, in theory, lets people to work in any job with a few restrictions. But it sounds great. but getting a job on open work permit is really difficult. And I've rarely seen people get a good job on open work permit. However, you do get an open work permit, and the children get a dependent visa. So if anyone has children who go to schools, they can certainly attend schools in Canada.
Okay.
There is no other process. It's just about making sure all the paperwork is through to get a training license, to get your visa.
Okay.
Sure, the medical college must be recognized by WHO, but now it's going to be World Federation of Medical Education,
Yeah.
which is already through.
So now
And
latest news is all medical colleges in India are WFME certified now since 1 week, I think so.
well, so the medical colleges in India are accredited by National Medical Council, and National Medical Council is accredited by World Federation of Medical Education.
Yeah.
So it's a two-step process.
Okay, got it. So now I think major issue won't be there for Indian students, I think so. And
even otherwise, there would not have been any major issues. I know there was a lot of panic, but I mean,
got it.
Most of the IMGs in Canada are from India. So they cannot afford to have any problems with India.
Okay.
The medical system won't function.
So now we know the process and pathway, sir. Now we're coming to the second part of the interview, which is the quality of life in Canada. I read one of your article in LinkedIn, which you posted recently. The stipend that we get is around $86,000. That's what you mentioned. And cutting the taxes and considering all those things, then you told that roughly 5,000 per month is what we can expect. So can you just explain a little bit about this part and how much expenses a common middle class man needs to do with one kid?
Sure. I think it's a great question.
Yeah.
Now I have to take a step back here and say Canada has two types of fellowship. So one is where the candidate pays the Canadian hospitals to do fellowship. The other is where the hospitals pay IMGs to do a fellowship. Now, the first thing where the candidate pays is not applicable for folks from India. There are many countries which sponsor their students, but of course, India will not. But for Indians, they usually look for a fellowship that actually is paid. Yes, you're right. The median salary is approximately $86,000. It keeps varying year to year, but you can expect a take-home pay of approximately $4,500 to $5,000. Now, Canada is an expensive place. The commodities is expensive. The sales tax is also expensive because Canada has a socialized healthcare. They have to collect a lot of taxes to provide, in theory, a free healthcare. So to summarize, I would say 5,000, 4,500 to 5,000 is a decent salary for someone with a spouse along with one or two children. You can save a lot. I mean, you can maybe $1,000, $2,000 if you really stretch your life too thin. But in general, you can save too much. I mean, you need an apartment to rent. Depending on where you live, that apartment can be quite expensive. So, for example, if you live in downtown Toronto, the apartment can be, you're looking at $2,500 to $3,000 for a decent 2-bedroom apartment. So there is a lot of expense there.
Yeah.
But if the overall goal is to stay in Canada, then that shouldn't be a problem. But there are a lot of people who actually spend some time in Canada and go back. For them, it might play an important factor, in which case they can try to save some money.
Yeah. So $2,500 to $3,000 is a big amount because you're getting only 5,000 for rent itself. If you spend so much, you'll be left with very less actually.
Absolutely. See, the bigger cities in Canada and the US are very expensive because the rental market is so hot that they tend to charge a lot of money on these rents because these are all owned usually by big companies. I mean, there are individual parties who own these apartments, but these are owned by big companies and their goal is to make money. So they charge quite a lot.
Okay. So got it, sir. So basically now I know about the finances and I know the pathway. and I know how to build my CV from MD first year, or at least whenever I start my preparation of CV. And about anything else, like climate, weather, they say it's very cold in Canada. So what should Indians are not used to that cold weather?
Yeah, so Canada can be quite cold. So if you look at the Canada US map, whatever the states in the US that go close to Canada are also very cold. So Canada is extremely cold. So I remember in Toronto, the weather used to last for somewhere about 6 months of winter, and you can expect a really good weather of maybe like 3 to 4 months. Yes, it becomes extremely difficult for Indians coming from a tropical area to to be in Canada. But the thing is, everything is centrally heated, so all the buildings would be heated, the cars would be heated. So it's only the problem is when people are walking outside, it's a problem. So the issue I used to have is I used to walk to my hospital, which was about 25 to 30-minute walk. I mean, there used to be a tram in Toronto, but many times I used to walk. The problem was when I used to walk in snow, I used to walk with a lot of thermal inside. But once I got into the building, I used to sweat so much that used to become uncomfortable. So, these are some of the things that we growing up in India are not used to, but eventually people get used to that. Indians are very resilient. You can put them anywhere, they can survive. And yeah, you're right.
And actually, one more set of audience in my channel actually want to go to Middle Eastern countries.
Uh-huh.
Because I've done a lot of interviews with specialists from Middle East countries. So
Mm-hmm.
I think the best way would be to go to Canada, do a fellowship, and go there. So that would be better, I feel, than going directly from India.
There are two kinds of folks here. So one is the best case scenario would be you come to Canada, do a fellowship, then go to Middle East. In fact, I have a MBBS batchmate who actually did his fellowship in Canada, who was in UK and now is in the Middle East. He's pretty happy. He's in Qatar.
Okay.
Now this is the best case scenario. You finish your fellowship either in Canada or the US, you go to Middle East. But there are other category of people because the fellowship in Canada is quite competitive. It's really hard to get into Canada directly. So for some of the IMGs who have a very slim CV, meaning who haven't done much things other than doing their PG training, I have suggested they spend 1 or 2 years in the Middle East and then build their CV there and then try to move to Canada. So
Oh,
I have suggested both ways.
got it. So
So
you're telling,
interestingly,
understood. Go to Middle East, build CV, and come to Canada. That is
right,
I am telling you, going to Canada, then to Middle East. Okay.
both ways are possible. So interestingly, the pay in Middle East, if someone is certified in Canada, is significantly more than anyone coming from India.
Yeah.
I hear the pay is 3 times more approximately for someone trained in, for example, UK, Canada, or the USA.
Yeah. So it makes more sense actually to invest 3-4 years in Canada and then go to Middle East. I think so. That is better.
Well, so here's what happens. If someone has invested 3 to 4 years in Canada, it's very unlikely they would go to Middle East. It's more likely they would try to settle in Canada or the USA.
Okay.
Because obviously the structure is conducive to have a freedom of life.
So now I have done my fellowship in, for example, pediatric anesthesia itself, and 1 year. And after that, I decided to settle in Canada. So how to go about after this with my visas and all these problems existing?
Yeah, so that's another fantastic question. So once you do a fellowship, now I have even explained using the example of one of my own junior who has been successful. So you try to find one or more fellowships, and after that, you try to get into a consultant or an attending physician job in one of the universities in Canada. Now, I call this a province-based specialist pathway. So let's say you do 1 year of adult anesthesia fellowship, the second year as pediatric anesthesia fellowship, and the third year you get a consultant job in one of the university hospitals. The university hospital will appoint you, it could be in any province, as an assistant professor of anesthesia. Now, the license you would have would be a full license in this case. Now, you would get a full license based on the recommendation from the hospital who has hired you. Now, the reason they would hire you is because they would think you're an outstanding candidate who has an amazing CV, plus you've done a fellowship in Canada. So once that happens, the hospital specific, the license would be restricted to that hospital, meaning that you won't be able to jump to any other hospital. Now, the hospital, in collaboration with the university, would say, okay, listen, doctor, you have 7 years to prove yourself. Now, you don't have to do something major to prove yourself. So they would give you some academic projects. So meaning they would tell you, okay, you need to write a research protocol. Of course, with guidance, they would guide you. And they would say, you need to go to a conference to do a presentation. Sure, you can always go. The conference might be a different city in Canada, or it could be in the USA. Good to travel. And these are some of the things you would achieve each year. So each year, as you achieve this, within 7 years, you have to finish the criteria set forth by the hospital and the university. So once they see you're good, you get promoted from an assistant professor to an associate professor.
Okay.
So as soon as that happens, the restriction of license goes away.
Okay.
After that, you're free to move about in any province in Canada. And if you decide to move to the USA, it would be significantly easier to go to the USA as well. So that's how the process works. And I call this a province-based specialist pathway. There are quite a few IMGs in anesthesia from India who have been successful with this, and many of whom I personally know them.
Oh, superb, superb.
Yeah.
And then after that, will they give you some green card? So whatever green card in USA, something similar to that you get, I think, so at that point.
That's another fantastic question. So what happens? So you enter Canada as a work permit. So once you do 2 years of clinical fellowship, you can apply for permanent residency through a class called Canadian Experience class. In my opinion, this is the best class to get Canadian permanent residency because it's sure shot. You apply for this, you don't even need an immigration consultant for this. This is that easy. Of course, I personally did a mistake when I was applying for this.
Okay.
But it's fairly easy to get a Canadian Experience class permanent residency. So you become a PR. So by the time you finish your fellowship, you start your consultant job. Usually in the first year or so, you're already a Canadian permanent resident without much effort. This is all the best case scenario I'm talking. And once you spend 5 years in Canada, based on whatever the requirement is, then you can transition to being a Canadian citizen. You get a Canadian passport.
Got it. Then that will be the best life actually. Once you have
that is the best case scenario for someone interested to move to Canada. And if you have a child who is born in Canada, irrespective of what your visa status is, that child will become directly a Canadian citizen by birth.
Oh, got it.
Yeah. This is the benefit of Canada and the USA. If children are born here, they become citizens.
Superb, sir. So next, the last question is, for example, now DMs are there. So the DMs actually who are niching down in neuro, pediatric, and we're already trained in India for a significant period of time. So for us, actually, what would be a better pathway?
So the folks who have actually done DM are in a good position to apply for that specific fellowship. For example, if you've done DM in pediatric anesthesia, I know PGI has DM in pediatric anesthesia and neuro anesthesia. AIMS has it.
Anesthesia, so many are there, yes.
Yeah. So if you have already done those 3 years of fellowship or sorry, DM in these specializations, then you can directly apply for that fellowship.
Okay.
Now what happens is if an applicant applies from India, the program director, whoever it is most likely to talk to an Indian colleague. It's easy to find an Indian colleague. Not all universities, but I would say pretty
Yeah.
much most of them would have an Indian person. So they would speak to them, and that Indian person would easily recognize the value of DM.
Yeah.
And it makes it easier to say, oh, this guy has fantastic training. He has done pediatric anesthesia DM from PGI. This
Yeah.
is this is just amazing. So I think we should strongly consider this. At least give him or her a chance of having an interview. So that's how the process starts. So people with DM should directly apply for the fellowship of their specialization.
And after that, can we continue the same thing there, or should we be a general anesthetist after that? That is the another issue that DMs will face. They want to niche down and want to continue the same zone.
See, I mean, ideally, if someone has done DM in pediatric anesthesia and they get a pediatric anesthesia fellowship in Canada, now they would have two options: exploring a pediatric anesthesia job in Canada or even in the USA. That's a separate path where you can finish your Canadian fellowship and move to the USA, just like how I did, without having to do residency all over again or PG training all over again. So those are the options. So see, I mean, here, unless the job is in an exclusive pediatric hospital or exclusive center, the anesthesiologist would be doing all types of cases, but mostly pediatric anesthesia in this case, or mostly neuro anesthesia in this case.
Got it.
But yes, there are opportunities to explore jobs specific to your fellowship.
Got it. The possibility of getting a job will become difficult, but if you keep your profile so niche, that difficulty might arise.
Well, I would say yes and no. Yes, because you've already established a niche. So in theory, it should make it easier. See, it all depends on the supply demand ratio.
Got it.
Some years there is a huge shortage of pediatric anesthesia specialization. So right now there is a huge shortage of pediatric anesthesia.
Oh.
But some years it might be a different specialty. So people who are in that time period will get lucky.
Okay, got it.
So, it's a bit of based on luck as well.
Got it, sir. So, then anything else you would like to add, sir, as a concluding statement? Thank you very much, sir, for coming to the channel. And guys, if you really want to have one-on-one coaching, actually, I'm feeling like I should go to sir for one-on-one coaching now after doing this interview. And if you really want to do that, the link is there in the description, and you can directly get into their company and have a one-on-one coaching with sir. If you want to settle in Canada, USA, and other countries, he would help you. And also, you can follow his YouTube channel. I'll put the link of the channel in the description. So, thank you very much, sir. So, would you like to say something, in the end to the audience?
Yeah, so thanks for having me here. I want to say, try to make the planning should start right from MBBS. I did not plan, but I'm saying if the plan is to move outside, the plan should start right from MBBS. So this is when you make sure you prepare yourself with academics, getting involved with research. Of course, I understand as an MBBS student, it's not easy, but at least as much as you can, wherever there are opportunities. And the most important thing that helps MBBS students is the fact that they can do electives in Canada. So electives lets you work with hands-on experience. It's not easy to get, but trying the right approach, you always have the chance of getting it. So try to do that and try to get into an excellent residency program. Sure, easier said than done. I understand that. But once you're in residency, irrespective of whatever PG you're doing, or rather wherever you're doing anesthesia PG from, if you have a plan to move outside to Canada, now focus on establishing yourself with conferences, presentations, research projects, publications, voluntary work, community work, be be active in some kind of sports, at least be able to say you're active in some kind of sports. So all this makes a huge difference. Now, when you apply for a fellowship, they're not going to see whether you know how to put an IV, whether you know how to intubate, how to put an LMA, things like that. What the program see is, are you a good communicator? How are you to talk to? Are you a team player? Now, if I hire you, are you going to be a very helpful a team worker? Are you going to be a pain in the neck? So these are the things the programs in Canada are watching. So be prepared yourself or prepare yourself for these things, and then your chances of success goes really up.
Oh, thank you very much, sir. So soft skills are more important than hard skills, is what in
Absolutely, absolutely. Hard skills are important in India,
yeah,
but here it's all about soft skills.
got
You
it.
don't put an IV, nobody cares.
Understood.
You know how to express that to patients. That's what makes a huge difference.
And how you escalate your senior and how you actually do it. Understood, sir. Very nice.
Absolutely,
So,
absolutely.
so thank you very much, sir. And with this, we'll tell bye to the audience. As usual, Dr. Dheeraj Masapu logging off. Roger that.